Understanding lymphoma. Types, symptoms, and treatment pathways. Lymphoma is a type of cancer that originates in the lymphatic system, a vital component of the body's immune network. This system, which includes the lymph nodes, spleen, and thymus gland, is responsible for defending the body against infection and disease. Because lymphatic tissue is distributed throughout the entire body, lymphoma can manifest in various locations. While many forms of lymphoma are highly treatable, the prognosis depends heavily on the specific subtype, the stage of the disease at diagnosis, and the patient's overall health. The two main categories of lymphoma. Medical professionals divide lymphoma into two primary classifications based on the characteristics of the cancer cells. Non-Hodgkin lymphoma, NHL. NHL is much more common than Hodgkin lymphoma and encompasses a diverse group of over 90 different subtypes. These cancers typically arise from mutations in B lymphocytes, which produce antibodies, or T lymphocytes, which assist B cells and fight viruses. Common subtypes of NHL include diffuse large B-cell lymphoma, DLBCL, the most frequent type, about 1 in 3 cases. It is often aggressive but generally responds well to treatment. Follicular lymphoma, a typically slow-growing cancer that can sometimes transform into a more aggressive form. Chronic lymphocytic leukemia, CLL and AMP, small lymphocytic lymphoma, SLL. These are closely related. The distinction depends on whether the cancer cells are primarily in the blood-bone marrow, CLL, or the lymph nodes, SLL. Mantle cell lymphoma, MCL, a more challenging subtype that is more prevalent in men and older adults. Hodgkin lymphoma, formerly known as Hodgkin's disease, this type is characterized by the presence of large, abnormal Reed-Sternberg cells. It most commonly affects the lymph nodes in the upper body, such as the neck, chest, and underarms. Classical Hodgkin lymphoma, CHL, the most common form, accounting for about 90% of cases. Nodular lymphocyte-predominant Hodgkin lymphoma, a rarer version where the cells often have a distinct, popcorn appearance under a microscope. Recognizing the symptoms, one of the greatest challenges in diagnosing lymphoma is that its symptoms often mimic common, less serious ailments like the flu or a respiratory infection. If symptoms persist for more than 2 weeks, medical evaluation is necessary. Key warning signs include swollen lymph nodes, persistent, usually painless lumps in the neck, armpit, or groin. Systemic B symptoms, drenching night sweats, unexplained weight loss, and persistent fevers above 103 degrees F/39. 5 degrees C. Physical discomfort, ongoing fatigue, chest or abdominal pain, and persistent coughing or shortness of breath. Causes, risks, and diagnosis. While the exact cause of lymphoma is not fully understood, it is driven by genetic mutations that cause lymphocytes to multiply uncontrollably. Risk factors may include a family history of the disease, weakened immune systems due to HIV, certain viruses like Epstein-Barr, or immunosuppressant medications, previous exposure to chemotherapy or radiation therapy. The diagnostic process typically involves a physical exam to check for swelling, followed by a biopsy, the gold standard, to examine cells under a microscope. Doctors may also use imaging, CT, MRI, or PET scans, or bone marrow samples to determine how far the cancer has spread. Treatment and long-term management. Treatment is highly personalized and depends on whether the cancer is aggressive or slow-growing. Medical approaches. Chemotherapy uses powerful drugs to kill cancer cells, common for NHL but can impact healthy cells, causing side effects like nausea and hair loss. Immunotherapy helps the patient's own immune system recognize and attack cancer cells. Targeted therapy focuses on specific proteins within cancer cells to minimize damage to healthy tissue. Steroids, often used to enhance the effectiveness of chemotherapy or boost white blood cell production. Managing life after diagnosis. While many patients achieve complete remission, some may face lymphoma as a chronic condition that requires long-term monitoring. Patients should also be aware of potential long-term complications from treatment, such as heart disease, secondary cancers, or cognitive changes. Addressing healthcare disparities, it is critical to note that lymphoma does not affect all populations equally. Data indicates significant disparities in outcomes for Black Americans. Research shows that Black patients are often diagnosed at significantly younger ages and at more advanced stages of the disease compared to white patients. Furthermore, they face greater barriers to accessing intensive treatments, such as stem cell transplants, which contributes to lower 5-year survival rates and a higher likelihood of treatment-related complications. Addressing these social and biological inequities remains a vital focus for modern oncology. Summary: lymphoma is a complex group of cancers affecting the immune system. While advancements in immunotherapy and targeted treatments have made many forms highly curable, early detection and addressing systemic healthcare inequities are essential for improving global survival rates.